This morning, like most mornings, you probably swallowed a small pill for your blood pressure without giving it a second thought. Maybe it was amlodipine, maybe Losartan, maybe Lisinopril, maybe two of them together. You have taken it so many times that it has become as automatic as brushing your teeth. But here is the truth almost no one explained to you on the day it was prescribed. These three medications are not the same. They do very different things inside your body. And there are 9 things about them that every senior taking them deserves to know. Some of these could be quietly affecting how you feel right now. Your ankles, your cough, your balance, even your kidneys. And you may have been blaming all of it on simply getting older. Now, let me be very clear before we take one more step, because this matters more than anything else I will say. These are good medications. They prevent strokes. They prevent heart attacks. They save lives every single day. And nothing in this video is a reason to stop taking yours. Please do not stop or change a single pill on your own. What I am going to do is make you the most informed patient in your doctor's waiting room so that you and your doctor together can make sure your blood pressure medicine is helping you and not quietly causing problems you have been blaming on age. My name is Dr. Goodman. I'm 65 years old, and in more than 30 years of practice, I have sat with thousands of patients who were suffering from a side effect they never realized was coming from the very pill they trusted. If that thought concerns you even a little, do me a favor and subscribe, because this is one your spouse and anyone you love who takes a blood pressure pill truly needs to hear. Let's go through the 9, one by one. Number 1. Your 3 pills are not interchangeable, and they do completely different jobs. Amlodipine is what we call a calcium channel blocker. It relaxes and widens the arteries themselves, opening the pipes so blood flows with less pressure. Losartan is an ARB, an angiotensin receptor blocker. It blocks a hormone that would otherwise tighten your vessels. And lisinopril is an ACE inhibitor, which blocks the enzyme that makes that same tightening hormone in the first place. Why does this matter to you? Because the side effects, the warnings, and even the foods and other drugs you must be careful with are different for each one. Knowing which type you take is the very first step to taking it safely. So if you are not sure, go and read your bottle the moment this video ends. Number 2, and this one surprises almost everyone. If you take amlodipine and your ankles and feet have been swelling, especially by the end of the day, that swelling may be coming from your pill, not from your heart. Amlodipine opens the small blood vessels so effectively that fluid can leak out into the tissues of your lower legs. Doctors see this constantly, and patients spend months terrified that their heart is failing, when it is actually a well-known dose-related effect of the medication. It is usually harmless, but it is not something to simply ignore either. Do not stop the pill. Tell your doctor, because sometimes a lower dose, or pairing it with one of the other 2, makes the swelling melt away. And stay with me, because number 5 is the everyday combination that quietly sends seniors to the emergency room. Number 3. That dry, tickling, persistent cough that has been keeping you, and maybe your spouse, awake at night. If you take lisinopril, your pill may be the culprit. The ACE inhibitors, like lisinopril, cause a nagging dry cough in a meaningful number of people, and it can start weeks or even months after you began the drug, which is exactly why so few people ever connect the two. Here is the good news. This cough is harmless, and it almost always disappears within a week or 2 of stopping that particular drug. And here is the better news. Losartan, the ARB, rarely causes this cough at all, so doctors can very often simply switch you. So if you have been living with a mystery cough, do not suffer in silence, and please do not assume your lungs are just getting old. Ask your doctor whether your blood pressure pill is behind it. Number 4. If you feel lightheaded, dizzy or unsteady when you stand up from a chair or rise from bed, your medication may be lowering your pressure a little too much at exactly the wrong moment. When you stand, gravity pulls your blood downward, and your body must react in an instant to keep blood flowing up to your brain. These medications can blunt that quick reaction, and for a few seconds, your brain gets less blood, and the room spins. In a younger person, that is a stumble. In a senior, that can be a fall, a broken hip, the single event that too often ends a person's independence. So protect yourself. When you get up, do it in stages. Sit on the edge of the bed and count slowly to 10 before you stand. Rise slowly from your chair. Be extra careful in hot weather and right after a warm shower when your vessels are already wide open. And if the dizziness happens often, that is a real conversation to have with your doctor about your dose and your timing. And let me pause for just 1 second, because I would genuinely like to know who I am talking to tonight. In the comments below, type which one you take. Type Amlodipine or Losartan or Lisinopril. It helps YouTube share this with more seniors on the very same medication, and it helps me make videos for what you actually need. Go ahead and then stay with me, because these next few are the ones that matter most of all. Number 5, the combination I warned you about. If you take Losartan or Lisinopril, your body now holds on to more potassium than it used to. Potassium is essential, but too much of it is genuinely dangerous because it can throw your heart's rhythm into chaos. And here is where seniors get into trouble without ever knowing it. Trying to be healthy, they switch to a salt substitute, the kind sold as light salt or no salt seasoning. But nearly all of those are made of potassium chloride. So now you have a pill raising your potassium and a salt shaker raising it even more, and sometimes a supplement on top of that. That stack can push your potassium to a level that lands you in the emergency room with a dangerous heart rhythm. So please, if you take Losartan or Lisinopril, do not start a salt substitute or a potassium supplement without asking your doctor first. This is one of the most common hidden dangers I see. Number 6, never, ever stop your blood pressure medication suddenly on your own, no matter how wonderful you feel. I know the temptation. Your numbers look great, you feel fine, perhaps a side effect annoys you, so you simply quit. But blood pressure that has been controlled can come roaring back, sometimes higher than it ever was. A dangerous rebound that can trigger a stroke or a heart attack. Feeling fine is not proof that you are cured. It is proof that the medicine is working. If you truly want to come off a medication, there is a safe way to do it. Slowly and with supervision, and your doctor will guide you down. The only wrong way is cold turkey. Number 7, watch carefully what else you take alongside these pills. 2 stand out. First, the over-the-counter pain relievers, the NSAIDs, like ibuprofen and naproxen. They quietly raise your blood pressure, working directly against your medication. And when you combine one of them with an ACE inhibitor or an ARB and a water pill, that trio can be hard on your kidneys. Doctors even have a grim nickname for it, the triple whammy. If you need regular pain relief, ask your doctor which option is safe for you. Second, grapefruit. If you take certain calcium channel blockers, grapefruit and grapefruit juice can cause the drug to build up too high in your blood. So check whether yours is affected before you make grapefruit a daily habit. Number 8. These medications call for a simple blood test from time to time, and skipping it is a real mistake. Losartan and Lisinopril both work hand in hand with your kidneys, and your doctor needs to check, now and then, both your kidney function and your potassium level to be sure everything is in balance. This becomes especially important anytime you get dehydrated, a nasty stomach bug, a hot day where you did not drink enough, a fever that runs you dry. When you are dehydrated, these medications can strain the kidneys. In fact, many doctors will tell you to pause your pill during a serious illness with vomiting or diarrhea, but only ever on their specific instruction. So keep those blood test appointments. They are not busy work. They are your safety net. And number 9, perhaps the most important of them all, especially if you are over 70. The right blood pressure target is not the same for every person. For years, everyone chased one magic number, no matter their age. But we now understand that pushing an older, frailer person's blood pressure too low can cause more harm than good. More dizziness, more falls, less blood reaching the brain. Your ideal number depends on your age, your overall health, and how you actually feel. So ask your doctor, plainly, what is the right target for me specifically? Ask whether taking your pill at night instead of the morning might suit you better, because for some people it does. And buy yourself a simple home blood pressure monitor. Check it at the same time each day, and bring that little log to your appointments. A week of real numbers from your own living room is worth more than a single reading in a clinic. Let me tell you about a patient. I will call her Margaret, 73 years old. Margaret came to me exhausted and frightened. She had a cough that would not quit. Her ankles were swollen tight, and she had nearly fallen twice getting up in the night. She was convinced she was seriously ill, maybe her heart, maybe her lungs. But when we looked carefully, the cough was her lisinopril, the swollen ankles were her amlodipine, and the dizziness was her pressure dropping too low when she stood. We did not stop her treatment for a single day. We worked with her doctor, switched the lisinopril over to Losartan, adjusted the amlodipine, and changed the way she rose from bed. Within 3 weeks, the cough was gone, her ankles were normal, and she felt steady on her feet again.
The same condition, still fully treated. She simply needed someone to connect the dots.
And that is all this video is, connecting the dots so that you can go and have that very same conversation. Now, before you go, the warnings you must take seriously. If you ever develop sudden swelling of your lips, your tongue, your face, or your throat, or any trouble breathing, that can be a rare but life-threatening reaction to ACE inhibitors like lisinopril, called angioedema. Call emergency services immediately. Do not wait, and do not take another dose. If you feel your heart fluttering, racing, or skipping, along with unusual muscle weakness, that can be a sign of high potassium, and you need to be checked urgently. If you faint or your home blood pressure is extremely high along with a pounding headache, chest pain, or changes in your vision, those are emergencies too. And I will say it one final time because it is the single most important sentence in this entire video. Do not start, stop, or change any medication based on what you heard here today. Take this knowledge to your doctor. This is education to make you a stronger partner in your own care. It is not medical advice for your specific situation. So there are your 9. They work in different ways. Amlodipine can swell your ankles. Lisinopril can cause that dry cough, and Losartan usually will not. Stand up slowly to guard against a fall. Be very careful with potassium and salt substitutes. Never quit cold turkey. Watch out for ibuprofen and grapefruit. Keep your blood tests. And ask your doctor what your own personal target should be. Write down the 2 or 3 that apply to you and carry them to your next appointment. You are not being difficult by asking. You are being a smart, informed patient, and good doctors love that. If this helped you, tap that like button, subscribe, and please send it to someone you love who takes a blood pressure pill. I'm Dr. Goodman. Take good care of yourself, and I will see you in the next one.